Hi, everybody. Thanks for joining. We're just going to give it a couple minutes for other folks to hop on.
That's weird. Oh, no.
So as we're waiting for a few more folks to hop on, if you're like me and getting a little restless being isolated, why don't you just go ahead and say hi in the chat box if you have it. I think we said, I hope folks can see that. You can chat with all and just say hello from wherever you're at today. Oh, the question box works too. All right, I'm seeing, hi Ann from La Posta, Rob from Elk Valley Rancheria, Ethan from McKinleyville, California.
Yay, yep. McKinleyville.
You can see, yeah, just go ahead and use the chat, the question box, everybody, in case you're having trouble with chat. All right. Well, Shasta, you want to go ahead and get us kicked off here?
Yes, good morning, everybody. Thank you so much for joining us from wherever you may be, whether you are at home, whether you are in the office. I hope some of you, if you are working from home, are able to be outside enjoying whatever weather you may be having. It's a little bit cool and cloudy here in San Diego, a little bit unseasonably cold for us, which means that it's in the 60s. So we had a great webinar yesterday with our Northwest cohort, and one of our participants, Aaron, he was sitting outside in his yard with the trees in the background and the sun shining, and I have to admit I was jealous. So if you are able to be from home and still working, I hope you're enjoying wherever you are. Thank you for being here.
Yeah, and hi, welcome back to all of you as well. This is our 4th webinar in our series, which means after this, we will have 4 more. It's an 8-part series. So we're almost halfway through. This is our 2nd webinar in a pandemic. So last time we were sort of at the tail beginning of all of this. So I really appreciate you all making the time to be here. I know that some of you are playing double duty on sort of pandemic roles, so I really appreciate your time. And well, as usual, we're going to make this interactive. If we can even draw some parallels with the current pandemic and what we're dealing with climate change, we'll do so as we go along. I hope we find you today safe and well in your own community. And happy Earth Day, which I know a lot of us are a little bit sad about missing out on celebrations. But at least, you know, in my community today, I see very fresh, clean air, and that's one way to celebrate. A pretty nice gift. And so just to reiterate where we've been in the first part of this training, we had previously established a foundation of basic understanding of how the 5 primary climate exposures will result in various impacts to health and other areas of our lives. And today I'm super excited because I like when we make this transition in this training from talking about some of the news or some of the impacts that can be somewhat scary and overwhelming to transitioning to, okay, how do we go and take action? And so we make that transition today. Today's part 1 of vulnerability assessments. And this means that we get to start identifying what are the most severe and likely impacts that are going to come to our communities so that we can address them. So this is where we're trying to develop meaningful information to make decisions about what to do, what actions to take to prepare for and safeguard our communities. And this will set us up nicely. So today we're going to kind of cover the first couple of steps of how to do a vulnerability assessment. It'll set us up nicely for next time, which will be a deeper dive into some data analysis, which is a big part of vulnerability assessments. So that'll be next round. And these 2 sessions set us up well for the next 2 sessions, which will be on adaptation plans. And that's where we pull together our priorities on strategies that can address our vulnerabilities. So that's where we're headed. Today, we're also really lucky because we're going to be joined a little bit later by a guest speaker, Dr. Douglas Walker. He is a psychologist and an expert that speaks globally on psychosocial recovery and resilience. He has experience with tribes as well. And he's going to speak a little bit later in this webinar. And our previous experience on this topic and with Doug has been people really get a lot out of that topic, and it's something new to think about in this landscape of climate change. Also, just a reminder for folks that are with us from SoCal, we will have our SoCal cohort today starting at noon. So be sure to join us for that. All right, let's go ahead and get into our topic of the day. So just to take us from last webinar to this webinar, we always suggest a reading. This reading is definitely applicable for the topic we're going to cover today. And so we had suggested reading the Oregon Climate Change Research Institute's Tribal Climate Change Guidebook. And so we actually only assigned a couple of pages, pages 36 to 38. That's specifically on the topic of engagement, so community engagement. We'll talk a little bit about that today. But this whole resource is actually very good. As I talk a little bit about it, if folks want to add in the question box, anything that you read in this, if you took a look, if it surprised you, if it resonated with you, you all have had experience trying to engage your community. Tell us a little bit about whether or not this seemed to resonate with you, or any particular tips that were helpful. And so, like I said, this is a great guidebook. It gives you a tribal perspective on making your way all the way through a vulnerability assessment and adaptation plan. So we certainly pulled from the expertise that was in this guidebook into the training that we're going to present today, along with a lot of other strategies and approaches, best practices that were mined from our network, which is pretty substantial, a network of advisors and experts that we work with. And so, this is really it's going to be a list of tips for how and when to conduct community engagement in your adaptation planning process. It provides case studies and links to resources. And so it also does a good job of showing community engagement checkpoints throughout the process. So one of the good points that we will make today, and these guys make, is that community engagement is something that happens throughout, multiple times through a vulnerability assessment, sort of depending on your level of capacity and resources to do so. Are there any chats or questions that have come through? Shas, any comments?
Not seeing any questions or comments, but even if you don't have any specific comments on the pages in the guidebook, since we're talking about engagement, it would be great just to see comments that you have about your own attempts at engagement with your communities. And I think I've shared this before, but that's always been one of the difficult parts in Paula, is getting effective community engagement underway. So if you have any insights or questions or comments you want to make about that, feel free to throw them into the box and I will read them out as they arrive.
Yeah, and take a look at these guiding questions here on the screen. These really resonate with me. These come from the guidebook, just in thinking about who to involve and how to do so, the best approaches for engaging these groups. I feel like whether you're a local government or tribal government, folks all around are really wringing their hands sometimes to figure out how to get the right people bought in, paying attention, showing up, responding to surveys. It's a real art. And actually, while folks are thinking it through, I do have one poll. Go ahead and launch this. You can see it, right, Shasta?
Yep.
Actually, would you mind reading it out? This doesn't let me read it very well.
So our poll today, or for now, which of the following best characterizes your experience engaging your community? You've got the choices of easy, people respond to requests and show up, or we have to work pretty hard to get people to participate, or we can't seem to get the attention of residents and staff. So see how we're doing on our poll.
A good amount of participation.
Yeah, we're getting there, but I feel like I need to do my usual. You know, yesterday I got a special request for the screaming goat, so let's make sure. Attention, we have a poll. Okay, there's our screaming goat to remind you to vote.
We have a good number of attendees today. I'm pretty pleased with the showing here.
Yeah, and as people are voting, we've got a couple of comments in the chat box or in the question box. Lori Montserrat says that she's found that we might think a community is not engaged because they aren't loud. Listening to the quiet community is also important. That's great. That's a great insight.
Yeah.
And Michaela Marr has a question. How do you improve attendance to outreach events? Yeah, it would be great to get some people's suggestions on that as well.
Yeah, and we'll have a whole section kind of to dive into some of that as well. All right, so let's go ahead and close this poll, see what people have to say, and I'll share it. All right, so 17% of people say it's easy. Good for you guys. These are the folks we want to hear from. What are you doing right? 69% think that they say that they have to work pretty hard, and 14% say they can't seem to get the attention that they need from their residents and staff. Really interesting. Okay. Well, I'd be very interested when we get back to this topic as we go through the steps of vulnerability assessments to hear from folks both about challenges and successes and what works. So if you could be thinking about that and willing to share, we'd really appreciate it.
And we do have some people are putting some great comments and questions in the question box about this. Aaron asks, have people had success with remote outreach and engagement? What helped make remote community engagement more successful? We're in the middle of our vulnerability assessment at the moment, did initial visits to 3 of our 7 member tribes, and had the remaining 4 scheduled for March and April. And I'm assuming because of the COVID-19 outbreak, as she says, we've been scrambling to figure out alternate ways to conduct our initial community meetings besides traveling to the villages. And Cynthia comments that for the tribe's relocation plan, land was purchased, but then because community engagement did not happen, the first attempt at relocation was scrapped. So showing how important engagement is. And Ambreen Afshan says, I work with communities of color and frontline communities. I have learned that consistent presence and engagement is very important and necessary. Secondly, working with local community leaders, community-based organizations, and faith-based organizations is very helpful as community members trusted those organizations. Very true. You've got to engage with those trusted leaders and those trusted organizations. And Chaz mentions that the Makah tribe had a planned community power outage during which they planned to have a community meeting where they provided free food and dinner, and every name of the attendees were added to an entry for a prize drawing, which was a power generator during a planned power outage. I love it. Your power is out. We'll feed you. We'll give you a generator. And speaking of food, Ann Turcott says, food. You got to have food. Great. Thank you, everybody. These are great comments.
These are great. Yeah. And yeah, that probably gets some wheels turning so we can talk a little bit more about this a little bit later, but awesome. Okay. So I just want to touch back on our framework because the framework that we've presented in previous webinars also guides the process that we suggest for vulnerability assessments. And so today we're going to cover how you can assess and prioritize the severity and likelihood of exposures and impacts for your own community. And that's going to include all of the exposures and impacts that we've gone over. So those 5 primary exposures that we've been over in subsequent webinars, as well as the secondary exposures that are triggered or result from those exposures. So worsened air quality, vector changes, water insecurity, food insecurity, and then how those exposures result in impacts or cascade down to impacts that happen within your communities, including natural environment, built environment, and health and social environment impacts. And so that's the realm of the vulnerability assessment, is looking at those things and trying to decide where the risks are coming from, and trying to decide which of those maybe are most prevalent, most important, most critical, according to what your community really values. And so that varies widely by community, by tribal community, by any community. We want to make sure as we go through this that, as part of this training, that we really talk about how to incorporate health into this process. So there's lots of best practices you can look at for tribal communities that have gone through a vulnerability assessment. Some don't include health at all. Some have a small piece of health that might be included. So we're coming from the perspective of trying to encourage health being a pretty prominent focus, which is often overlooked by lots of different communities. So we'll talk about how to do that. And then just a little note here, just a rally cry, that communities that begin to plan now will have the best options for adapting to climate change. And so some of you are probably in the process and others are hoping to get started, and all of that is okay. We're going to talk a little bit about how to get going. So one of our key messages through this part of the training is that there is really no one right way to do this. And there are multiple types of planning processes that could be employed to start to look at your vulnerabilities. And so I just want to talk about the different paradigms that different types of professionals use to do some preparation that could include climate change preparation. So there's a public health planning approach. So if we're talking to health professionals, their paradigm is typically to do this 2-step process, which might include a community health assessment, and then once you've identified the health issues, the health concerns, that you would then create a community health improvement plan, which outlines strategies to address those concerns. And so this is the 2-pronged kind of idea: identifying concerns, addressing concerns. You'll see matched in each of these different sort of industry approaches. The one we're going to focus on today more so is the climate adaptation planning approach, which typically starts with a climate vulnerability assessment, where we identify and rank our concerns or vulnerabilities, and then follow that up with a plan to develop a plan of strategies to address those concerns. Similarly, the emergency management side of things, so emergency professionals might start with a hazard mitigation plan. I know a lot of you guys have those, and then might follow up with an understanding. After you have an understanding of your hazards, follow up with an emergency management plan to really figure out how to operate after an emergency, or during an emergency, or before an emergency. And so this is sort of an ecosystem that can work together. There are communities that have all of these, and in some ways you can, when I work in a community, I pull from all of these if I have access to them, to make sure that there's consistency amongst the plans, and that public health and emergency management are incorporating climate change as an important piece of information in the projections that they're considering for the future. And then I pull from hazard mitigation plans and public health documents as much as I can into, say, a vulnerability assessment, so we can do a good job of understanding, getting as much information as we can that's valuable and meaningful to identify vulnerabilities. And so I have one more little poll here. I'm curious for folks on the line today, a little bit more just about where you're at with planning processes and if you've done some of these plans already. So I'm going to launch this And maybe Shasta, you could read this again for me.
Sure. So the question is, the tribal community I'm working with has completed the following planning efforts. Check all that apply. Community vulnerability assessment, climate adaptation plan, community health assessment, community health improvement plan, and hazard mitigation plan and or emergency management plan. So again, here's the goat. I know even if that just cracks me up, that's good enough for me, but I know some of you.
It's all worth it.
Oh, we've only
And I
got
think you
29% who have voted.
What's that?
I just said only 29% have voted, so come on, folks, vote.
Yeah, let's give it a few more seconds here. I think that you should be able to choose more than one option, by the way.
And for the community health improvement plan, Angie, maybe you could explain a little bit how that's different from the health assessment.
Yeah, so the health assessment is going to pull data on things like health outcomes and try to do some projections on future health related challenges. So it's looking for health vulnerabilities. And so it's identifying those and prioritizing those. Same as we do in the climate change world with the vulnerability assessment, but it's focused specifically on public health. And then the community health improvement plan would actually be, once you have a decision about your biggest your biggest vulnerabilities in health, then you're coming up with strategies for improving your community's public health.
And you know what I'm thinking here now that we've got about 52% who have voted, we didn't put an option here for none of the above. And I'm wondering if that's why we haven't had as many people vote on this one.
Good point. Next time. All right, well, let's go ahead and close and share the results. We'll keep that in mind. All right, so yeah, I kind of expected a lot of people have done hazard mitigation plans and or emergency management plans. I think part of that is because there's typically a requirement to do a hazard mitigation plan to be in line for certain FEMA related funding. So there's an incentive to stay on top of that. Looks like 26% have done community vulnerability assessments and 26% have done climate adaptation plans. I'm wondering if those are the same people that they've just gone through both steps. And then yeah, 9% community health assessment. So yeah, I don't see those as often in tribal communities, and if they are done, they're often not done in-house. They might be done on a more regional basis. But great. Okay, helpful. All right, so we're going to do a little bit of an overview of the whole adaptation planning process, and then we're going to dive a little deeper on vulnerability assessment steps. So the purpose of adaptation, oops, I got to hide my poll. You can see my screen again, right, Shasta?
Yes.
All right, so the purpose of adaptation planning. So we know, we've talked about this a lot. Climate change is expected to affect many, if not all, aspects of tribal communities, from wildlife to community health, your economy, your culture, your sovereignty. And so the projections that we've gone through in this webinar series are showing that these changes will become more extreme in the next decades. And so adaptation plans are an attempt to move communities towards a state of preparedness and resilience. So now we have eyes wide open. We know what's potentially coming our way. We need to know more specifics about how it's going to affect our community so we can do something about it. And your tribe, the intention is that your tribe can make clear decisions if it better understands the magnitude, likelihood, frequency, and timing of threats imposed by climate change. The idea here is that we know tribal communities in particular, but everybody has limited resources that is already being stretched over a variety of priorities. And here comes climate change with projections for getting, for already hitting in some ways and for getting worse in future decades. And so how do you make decisions about where to allocate resources to prepare? Hopefully that's data driven. Hopefully that's driven based on your values and some community input. And so tribes all over the country are preparing. They are preparing by conducting vulnerability assessments and adaptation plans. And on the right here is a map that actually is provided by the BIA, Indigenous Peoples Resilience Actions. And this is a place you could go and visit and actually see what your fellow tribes are doing across the country to start preparing. And so you'll see a lot of these are based on BIA awards for grants that have paid for planning processes or certain projects that might be adaptation related. I'm actually going to show you on the website here. This is coming from the BIA. You can actually look, if you want to get an example of what tribes are doing, you can kind of look at recent Tribal Resilience Program award funding and just get an idea of what other tribes have proposed for funding to do certain kinds of projects. Oh, hey, here's Paula. This is what paid for this training right now. So yeah, all over the country, just a way to scan to see what your options are for not only for this funding source, but just in general, what people are starting to do to get prepared. So I recommend taking a look at that in your own free time. But I do like this quote from the Swinomish tribe in Washington. They say, if adaptation is to be our future, we at Swinomish will have already proved ourselves equal to the challenge. In the spirit and knowledge of our long history, I urge those within our community to embrace this challenge and meet it with every confidence of success. That is the true essence of Swinomish. That is like, that gave me chills again, because it's just empowering. It's a nice place to approach this from, that, and I do think that's true for tribes who have demonstrated resilience for hundreds of years. Okay, so this is a diagram that we've come up with that really simplifies the steps of doing adaptation planning. And so the first step is a vulnerability assessment. And the idea with adaptation planning is to prepare to address the impacts of climate change on your tribe. So it's first critical to understand your tribe's unique and most significant vulnerabilities, including health. So that's why we start with a vulnerability assessment. Later on, we'll talk about adaptation plans. And then, of course, like any plan, that plan needs to be adopted, implemented, evaluated somewhat regularly, and eventually updated to keep it fresh. And so those are the steps we're going to kind of talk through in the remainder of the webinars. What I like about what we've done here is a lot of the heavy lifting when you first do a vulnerability assessment and adaptation plan, it happens in the beginning. So you're setting this really big foundation of information and decisions that you can work off of. And then in the future, you have a cycle that continues, but it isn't going to require the humongous heavy lift in the beginning. Again, now you're sort of on track, but this is a continuous improvement process. So once you start this, the intention is that you're continuing for a long time. We don't have any indications to show that climate change is going to be less of a problem anytime soon. So vulnerability assessments, what are they? They catalog and they synthesize information on biophysical conditions, community assets, and other locally relevant characteristics that are likely to be most strongly affected by projected climate changes. And so this is the formula that we use, and it's kind of amalgamation of what the literature tells us. It's really vulnerability is a formula based upon the severity and likelihood of your exposure risks. So how severe and likely is it that storms are going to be disruptive? How severe and likely are droughts? How severe and likely are temperature extremes coming to your community? Those climate conditions that are coming, what does the data tell us about it? What do our observations and stories and experiences tell us about how things are changing? To that, we add an impact risk. So what, as a result of those exposures, what's actually already happening on the ground today and what's projected to happen on the ground? So things like heat-related illness, gastrointestinal illness, injuries, deaths, facility damage, those types of things. And we like to think about the impact risk, the severity and likelihood of impacts in terms of what do we care about. So not all impacts are maybe equal. If a drought comes, maybe if temperature extremes come through your community, you get more heat. There's even a possibility that for a short period of time, warmer temperatures in some areas may actually assist in some agricultural crop production. So that wouldn't necessarily be a harm that you need to address. Just that's kind of like a weird example because it's a normal curve, and generally agriculture might be in the future more damaged, but for a short period of time we might see some increased crop productivity. But it matters whether or not it's a threat to things that you consider to be valuable assets. And so we'll talk a little bit more about what do we mean by assets, and how do you get your community to tell you what is important to them to protect. And so that's part of what we'll talk about. To that impact risk, there are a couple of moderating factors. So maybe we stick with the heat extremes. Certain certain community characteristics will make a population more sensitive to certain impacts. So, for example, if you know that extreme temperatures are coming your way, heat's coming your way, but your community doesn't have a good rate of household air conditioning, then you might be more sensitive than another community would be. On the other hand, adaptive capacity may mean that you've already designated cooling centers and come up with backup power systems in case of brownouts and power outages. So you might have built some adaptive capacity already. And so those are the kinds of things that can moderate your impact or your vulnerability. And so all these things matter because part of this process means that you're trying to determine what are your biggest vulnerabilities. And a couple of just key questions to think about as we kick things off here. Are health-focused vulnerability assessments different? Not in general in terms of the process that you go through. All it means is that you'd be incorporating health as a key topic, and you're going to look for health impacts. So you're going to actually look at health information. If you wanted to do a specific climate change health vulnerability assessment, you could. You can make it that specific. Otherwise, I see folks doing a comprehensive assessment that are incorporating these health impacts. And so what if you've already done a vulnerability assessment, like 26% of you have, but it didn't include health? Well, that's okay too. I've seen communities that actually supplement their vulnerability assessments, or maybe on their next round when they update their vulnerability assessments, they can include health in the next iteration as a more detailed topic. All right. I'm doing a time check here, and yep, we've got a speaker coming on in about 20 minutes. So we're going to try to get through the first couple of steps. So like we said before, there is no right way, one right way to do a vulnerability assessment, but there are a bunch of different approaches for you to consider as you're just starting to think about vulnerability assessments and how you'd want to conduct one. And so one way that they vary is whether or not they're going to be top down versus bottom up. What does that mean? So top down might mean that you are looking mainly at big external data sets that are telling you about climate conditions, and you're just going to make decisions based on what the data is telling you. Bottom up might mean you're spending all of your time talking with your community about their observations, experiences, concerns, priorities, and you're going to make all your decisions that way. What we would recommend is to meet in the middle and use both of those types of information to do your analysis to have the most value. You can also decide to do a comprehensive vulnerability assessment or a focused or specific vulnerability assessment. So you could look at specific topics. Say you want to only look at health, you want to only look at your built environment, you only want to look at its effect on wildlife. Those are all things that you could look at. You could look at only specific assets. So maybe you have a really key economic driver, a facility that's a key economic driver, and you want to know more about the climate impacts that are coming that might affect it. So, maybe it's a hotel or maybe it's a golf course. You can also look at various locations. So most tribes that I've worked with are looking, if they have a reservation, their boundaries are the reservation lands. If they don't have a reservation, they might be looking at generally where the tribe, most of the tribal members live, and looking at maybe a city level or county level. But you could specifically look at just a portion of a reservation. You could look at feed of trust lands. You know, there's ways to carve this up differently.
So we have a question. Sorry, we have a question here from Lori, which I think is a good question. She asks, is there a reason that you would not want to include health in a vulnerability assessment? As in, do some grants exclude health as an endpoint, or are there other reasons? And you know, as far as what a grant might cover, I think, yes, sometimes there are very specific deliverables that a grant is looking for. I know that with the EPA, for example, they have money out there for climate change, but you're not allowed, at least not explicitly allowed, to do anything that has to do with tribal culture or cultural preservation. So if you are looking at what the effects of climate change are on, for example, traditional gathering practices, you just have to find a way to frame that so that it doesn't look like you're spending the money on something that's not allowed under the grant.
Yeah, and Shasta and I, you know, she actually just got a transportation resilience grant, which, you know, it's requiring us to do a transportation vulnerability assessment and adaptation plan. And it's, I would still argue that health should be involved, you know, will be involved in something like that. But you know, obviously you have certain topics. I haven't really come across something where health would be a completely ineligible topic to discuss.
Yeah, you just find ways to get what you want in there by using the language that they expect.
So other ways that vulnerability assessments differ is by information type. So some vulnerability assessments might be driven completely by indigenous science or indigenous information, which might look more like traditional knowledges and records, stories and observations that are maybe recorded either verbally or orally or in written over centuries. And then of course there's Western science information that would look more like scientific data and databases that you might find in various publications or from various government agencies. And we recommend, if you have access to both, to use both and just get the best of both worlds. And some people call that a braided approach. The individual, another way to differ is whether or not you're going to do a vulnerability assessment as an individual community, so just your tribe, or a collaborative approach to a vulnerability assessment, meaning multiple tribes involved. This may probably also result from if you have a grant that you applied together, then you would certainly do something together. You would do a vulnerability assessment together. There are trade-offs to whether or not you go alone or go together. Going together might leverage resources really well. Going it alone might help you go a little bit faster in some cases, or have a more customized approach where the input that you receive is very custom to your own community. So that one's really up to you and what you feel like is most will help you move along. Weaknesses or strengths. So this is an interesting topic. So a lot of vulnerability assessments were focused so much on the threats and the risks that we're looking for weaknesses. Where are our weaknesses so that we can resolve them? But there are lots of vulnerability assessments that also do a good job at looking at strengths, meaning where are we already resilient? Where are there cost-effective opportunities for us to build upon the things we already have in place to become even more resilient? And then finally, these things differ wildly by process. And so on the right, you see a lot of different approaches to getting through a vulnerability assessment and adaptation plan. So here you're seeing an example. Top left is California's process for its Safeguarding California plan, I want to say. On the right is from Swinomish, actually, who took the CDC's BRACE framework and indigenized it. And so you see, you're seeing a trend of a lot of cycles going around, and that's just indicating that continuous improvement concept where this is not stopping. We are starting a process that we will continue. But a lot of these are similar in a lot of ways, meaning the steps you go through are they kind of show a pattern. So things like, forecasting, assessing, and then prioritizing, and then coming up with strategies. The one down below, that's coming again from that tribal climate change guidebook that we talked about earlier on, where there's 5 steps, and I like this one because in the middle, it's centering the whole process around the tribe's centering the tribe's adaptation effort, and really focusing on the tribe's values. So Nomish does a good job of doing that too, really diving in and trying to understand what those tribal values are. And then of course on the bottom left is ITEP. ITEP has lots of resources and templates and things that you can use as well. And we'll be pointing to some of those as we go along. So I want to start just at the beginning, just diving into the first couple of steps on vulnerability assessments. And this messy slide is really just showing you all 5 steps. So the first step will be determine objectives and scope of your vulnerability assessment. The second will be engage your community. So those are the 2 we'll go over today. And then the next round, we'll go through identifying key indicators, gathering and analyzing information, prioritizing vulnerabilities, and synthesizing and presenting results. And a lot of that has to do with data. So like I said, that'll be next time. And what I'll do throughout here is to connect you with the companion tools that the Tribal Climate Health Project that we have built for you. So a lot of what we've done as part of this project is not just develop these trainings where we can talk to you, but trying to figure out what can we actually do for you to lift the burden of some of this work and make it a little easier to get through, so that you can find information more easily and accomplish some of these steps. And so we'll share with you what some of those are as we go throughout. So the first step is, and this, like I said, we've mined this from a lot of our network experts and looking at best practices. And it's really important in the beginning here to determine your objectives and scope of your analysis. And so one of the ways to do that, basically that means, what are we doing here? What's this assessment going to be about? And sometimes you might start with some specific direction that came from your council. And so even if you haven't had this done yet, this is a good way potentially to get some buy-in early on and make sure that there's some awareness around your effort to do this kind of a planning process. Partially because the last thing you want is to have done all of this work and develop plans that either nobody supports or nobody's paying attention to, nobody participated in, or just sits on a shelf and collects dust. So you want some community buy-in around your efforts here, so that when you are done, it can be better utilized and there's more people involved in implementing it. So this is an ITEP template there on the right, which is great. And we actually used this when we did Paula's vulnerability assessment. And so you can see here just some draft language. I'll show you where we have this on our website. You can just download it and customize it as much as you'd like for yourself. And so part of what this kind of a thing does is to tell you who's responsible for the vulnerability assessment, maybe your parameters, your time frame, what specifically you're going to look at. And so there it is. So our tribalclimatehealth.org website, if you haven't been to it yet, we recommend taking a look. There's a whole section on training materials, so that's the URL. And on that page, if you scroll down, here's a link to the ITEP's Tribal Climate Change Resolution template. And so, like I said, sometimes within that tribal resolution or outside of it even, one of the key things to do is to designate lead staff. Who's responsible for doing this, for overseeing this project? And just because one department might be made responsible doesn't mean that the other departments are left out. You just need to know who's going to carry the thing, the football all the way to the goalpost. And so one point to make here is that in my experience, having done this work on the inside of a government and working with lots of other governments, including tribes, authority and relationships definitely matter. So in picking the right person to oversee the project, I know that not all tribes have a lot of options about who's going to do it. It's probably going to land usually in an environmental office, but in some cases, a tribal business office or somewhere else. Picking someone who has some trust with their tribal council, has the ability to pull in folks from other departments so that they actually pay attention and show up, really matters. So, somebody who can sustain relationships and some respect amongst their colleagues would really matter. Shasta, I don't know if you want to chime in on any of that or your experience.
It is important, I think, to have just a couple of people. If you've got too many chefs, then you end up with sometimes a meal that's not particularly digestible. So definitely make sure, if you can, that you've got a single person designated. Now, I say that with the privilege of having a large staff in my office. It may be that you're thinking, yeah, I know who the person's going to be because I'm the only one in my office. So in that case, you can check off step one. You're done with designating your lead staff. But if you can make that, have a point person, whether it's you or somebody else in your office, that's important to do.
So in the question box, as I'm kind of talking a little bit now about grant requirements or grant, the role of grants and all of this, if you have any thoughts on, how have you successfully obtained dollars to conduct vulnerability assessment and climate planning work, and just tell us a little bit about if there were any limitations or stipulations. So this is tied into what Lori had just brought up for us about whether or not your vulnerability assessment, how you craft it, what your options are, its parameters, if that's going to be limited or driven by a grant source. And oftentimes, yes, usually it's that there's a requirement to have a certain element in there. And so, if you have something that's coming from more of a environmental or wildlife source, you might need to do more with natural resource impacts. But like I think Shasta and I are both saying, usually those grant limitations don't actually eliminate health from being a topic that you address.
And make sure that you are creative in the way that you look for money. There are ways to get money for some of your climate work without being explicit that that's what it's for. So for example, right now we have a FEMA grant for updating our hazard mitigation plan. And in the application for that, you don't necessarily put, we're going to include climate change as a hazard, but when you include the broader risks of climate change, whether it's flooding or drought or increased wildfire or loss of land through coastal erosion, you can put those things and say, these are hazards, and we need to assess our vulnerability to those hazards. Boom, you just did a climate change vulnerability assessment. You just didn't call it that. So if anybody has any ideas or places to get funding, things that you've done to massage your funding into climate change work, please throw those into the question box and I will share them with the group.
Sounds good, thank you. Yeah, I think somebody maybe have dropped a question in. Did you see anything come through?
We have the same questions, nothing new yet.
Okay, great. All right, so setting those parameters in the step one would include things like, what is your time frame? So maybe your council or your grant is driving a deadline. Sometimes that's really helpful. Even if nobody else is telling you to have something done at a certain time, I think inventing a time frame could really be helpful too. These things have a tendency to, you get better attention if you have a timeline and an actual end point. And that way you can work backwards and make sure you're getting all your steps done. Boundaries, so like we said, is this going to be limited to if you have reservation lands, the boundary of your reservation land? Is it larger? Is it smaller? Are there particular exposures of concerns that you want to focus on? I've seen tribes look at specifically flood, doing a vulnerability assessment on flooding or a vulnerability assessment on heat. And then are there specific impacts of concern? So, is your tribe primarily interested in health, natural or built environments? And then, like we said before, key assets. So you'll want to actually just spell these out in the beginning of your vulnerability assessment. What are the parameters? What are we studying? And then select an approach. So like I said, I kind of introduced you to some various approaches that different organizations promote. You feel free to use ours, the step-by-step approach. You'll just want to know the trajectory of what steps you're going to take to make your way through the process. And this looks like a linear process, and we're presenting it in steps that seem sequential. But P.S., this is a human process. We are very aware and encourage you to flow these steps as much, not in a linear fashion if they aren't built to be that way. Basically, we see tribes doing these steps generally in this order, but you could do steps more than once. You can come back to something. You really have to customize it to what's working well for your community.
So we have a comment from Erin Shu, and I love it because she's given us a new euphemism. She says, directional environmental change is a euphemism we've used successfully with our federal grants, especially for ocean acidification projects. I love it, directional environmental change, because so much these days you see resilience or extreme weather events, but I've never heard directional environmental change. I'm totally stealing that. Thank you,
Erin. You may have noticed I just went over a couple of slides. We're going to save the discussion on the a really great tool that we built, the exposures, impacts, and strategies inventory, or EASY tool. We're going to dive into that really deeply in our next round. So we're not going to talk about it too much today. I'm going to spend just a couple of minutes again back on engaging the community. That's step 2. So once you've set up the parameters, you've set your objectives and scope of your work, it's time to start engaging your community. That could mean, why do you do that? You would do that to gather knowledge, oral histories and stories, observations, data, priorities. You really want to learn about the concerns, and not just concerns, but also the existing resilience and preparedness activities that your community is aware of. So sometimes it's, you're brainstorming with your community. Really good not to be so myopic just within your department, but to engage other people's ideas. So you can help determine what community assets are most valued and important to protect. And you would also coordinate regionally to make technical analysis more cost effective. So you can bring in some other, leverage some other agencies around to see what other information you can bring in, what other levels of expertise and advice you can bring in. And then, another role for the community members that you engage is to review findings and drafts. So I think we did a good job earlier of listening to some methods that work to get meaningful input from your community, but I would encourage you to also go back to the question box, and if there are other methods that have been working best to get meaningful input from your community, to please include them there.
And I did have a request to copy and provide the questions and comments on that subject. So I will save those, and I'm going to start a new thread in Groups.io where people can throw in their suggestions, their questions, and let's just workshop this through that process and get some ideas.
That's a great idea. I think that would make a great email dialogue. So I just want to point out some different ways to engage. So this isn't all about getting somebody to come to an event. There are a couple of really important pieces here. So one is to develop a planning team. So these are the folks that you would want to have on sort of a steering committee to help drive the process of completing your vulnerability assessment, and even later your adaptation plan. So when I work with a community, I'm often looking at other department representatives, outside advisors that might be helpful. So you might look at university folks that are around and have an interest in tribal issues, or regional climate centers if you have somebody who's willing to do some kind of pro bono technical advising, bringing those folks in. And then don't forget to engage health. So if you've got a local community health organization like Indian Health Council or something, bring in a health staff. You can even bring in local clinic staff. You can engage tribal epidemiology centers. There are 12 of them in the country. We've mentioned that before. And you also, if you have a good relationship with your county epidemiologists can be a great addition. They have lots of data that you might not otherwise have access to, and they can help drive some good information on health. You're also going to want to engage your community members. There's a couple ways to do that. There's active engagement, which means you're actually looking for a two-way street. You're looking for input and participation from those folks. And there's passive engagement, which means you might just want to inform them that this process is happening so that they're aware. And so things like, this is Paula's climate change website where they're posting their activities, their reports, some general information, fact sheets and things for climate change, because it's kind of more community awareness and education related. But up here, I do want to point out that Tribal Climate Health Project has developed a survey that's called the Climate Vulnerability Experiences and Priorities Survey. This is something you can download from our website. Again, back to that training materials page. You can download it. It's a Google form. It's free. If you download it, you copy it and then customize it for yourself. This is one way to get some information from your community and, very cheaply and efficiently. We recommend that you also do whatever else you can in terms of focus groups, workshops, interviews, if you have the resources to do that. And not every community does, but more in-person engagement would be great. You can also just use this survey questions as a template when you do in-person engagement as well. But it's going over various questions like which climate exposures are you most concerned about? Secondary exposures, what are they most concerned about? And then it gives you an opportunity for them to help you rank community assets in terms of priorities. So this is often very surprising to me. In this community, water resources were the #1 community asset that they wanted to protect, and transportation infrastructure was at the bottom. And I wouldn't have known that if I didn't ask. You also get some quotes and testimonials from your community this way. So it says, I'm worried about fires in our area. The dry brush on our reservation is extreme. So the survey is asking for people's observation about what's changed over time. Okay, so I actually think now would be a great time. I'm sure we have Doug.
We do.
Okay, Doug, can you go ahead and turn on your webcam for us? We have our guest speaker. So Dr. Douglas Walker is with us today, and he's been, well, we saw your lights. There you are. Okay, make sure your microphone's on too, if you would.
Yeah, good afternoon.
Hi, okay, good. We hear you and we see you. So Dr. Walker has advised our project for almost a couple of years now, and he is a psychologist. He's been with Mercy Family Center in Louisiana for a long time. He's the program director, and he runs psychosocial programs that across the country, across the globe, really, and does speaking engagements. He's a real expert. He gets brought into communities that have suffered with various types of emergencies and disasters and attempts to help them recover and become more resilient. And so that's really the topic that he's here to discuss with us today, giving you some introductory information on psychosocial recovery and resilience. This won't be brand new to a lot of you. We've talked about mental health impacts in some of our previous webinars, but now we get to really dive into this emerging topic that we would encourage you to think about as you're doing your vulnerability assessments and adaptation plans. So thank you, Dr. Walker. I'm going to go ahead and I'll hand over the controls to you.
Okay.
Okay, this should be all yours.
Okay, let's see what we got here.
I think we see your screen. Yep.
Okay, and hopefully a slide deck here soon.
Yep, I think you just need to run your slideshow.
We're almost there. I don't know. Yeah. You get rid of a few things. Can you see me now?
We see your,
Can you see the slide deck?
we can see the slide deck, but it's giving us the presenter screen.
Okay, let's change that. All right.
I need to just, if you have two screens, change to the other screen.
you know, let me close a few things. Your patience is very welcome here.
This is the fun part about this new world we're living in, is figuring out how to navigate the technology.
All right, let's see. I'm gonna try showing the slide deck again, and hopefully it's not presenter view. If it is,
I can always run slides from my
I
screen
prefer
as
not
well.
to have that. It's actually a distraction to me. Yeah, do you mind running? Yeah, because that's just going to be easier. There's some animation, but I'm not worried about that.
Yep.
So you want to take the football back?
Sure.
Okay.
I love these sports metaphors. I think we're all very much missing, well, I don't know about all, but I know I am weeping over my lack of baseball. And I know that there are bigger, more important things to be crying about in this day and age, but baseball is one of my sanity preserving background noise favorite things. And so I am now insane.
There you go. All right. So let's kick this off, shall we? So thanks for inviting me to share with you some ideas, concepts around climate change. And the first thing I want to make a point of is that when we talk about mental health in particular and climate change, whether it's direct impact, and we'll talk about what that is, certainly wildfires and floods, or indirect or slower impact around, say, slow rising water or land that sinks, we have to remember that there are always pre-existing conditions. And so I look at communities, whether it's mine here in New Orleans or other communities across the world, that there are individuals who are already vulnerable. And we have to remember this prior to any one event. In fact, in my experience, and even now living in this day of COVID, it's the individuals who are already, say, fragile that are most impacted. So we have to kind of care and think about those individuals first, but also know that the stress that comes with climate change will impact everybody to some degree. I do think that we must consider mental wellness as really a continuum, where at one end, maybe the far left, we would consider something as a stressor. And at the far right extreme end would be something that is traumatic. Next slide. So as far as direct impact, we're beginning to look at these events, these man-made disasters, as strong signals of climate change. And so here in Louisiana, we have more extreme storms. Those are our direct impacts. In fact, we had, which is unusual, we had an EF2 tornado in our neighborhood, about a mile away from my house the other night. Unusual, and these are things that certainly keep us vigilant. But also here in Louisiana, we have these indirect or more long-term climate change signals, which include rising water and sinking land. And many of you know that we down here impact in such a way that there are even tribal communities who are currently relocating or planning to do so. Next slide. This is a busy slide, it's not mine, but it makes the point around the connectedness between physical health, mental health, and community health. And they're all interrelated, because we know that if someone is suffering from, say, a physical illness, primarily diagnosed as such, that there are coexisting conditions like depression or anxiety that can also occur. And in turn, someone who is maybe suffering from depression, anxiety, addiction can also bring upon themselves difficulties in their physical health. So for instance, if someone is challenged with depressive symptoms for many months or years, let's say their activity level may suffer. And so with that may come some weight gain, and with that even more difficulty in cardiovascular challenges. And certainly collectively as a community, all these things make up your ability to interact with each other and evoke change for your communities. We know that healthy communities are also happy ones. And so that's really what we're talking about here, is a quality of life to maintain no matter what is facing us in the decades to come. Next slide. So as a reference, I wanted to look at some brief research. I'm not a researcher per se. I'll write about things I'm interested in and a few things I've done, but I do want to highlight that some people have delved into the impact of climate, particularly in the north, in the First Nations of Canada. Next slide. And some of the news coming out of that, those studies are not surprising. So there are strong emotional reactions to the loss of land, particularly in their case, ice. So the warming of the Northern Territories has included not only a loss of ice, but a loss of permafrost. And so strong emotional reactions could be, and if you want to just hit a few of those, Angie, we've got some animation. Yeah, so there you go. So sadness, fear, depression, frustration, devastation. You know, so literally the land from which on which you walk has changed, and there's not reference. And other reports out of these areas include, you know, certainly changes in migration, and so the hunting patterns change. Oral histories around hunting and tradition do not apply. There are elders who have never seen these types of migrations occur, so there's not much reference to go to be able to make some kind of adaptation. Next slide. So we are all challenged with drug and alcohol use to different degrees, and what's been found up north is that with all this empty time comes a way to fill it, and sadly it comes with drug alcohol use. And this is not only a cause from, say, natural disasters. We are just 10 years beyond our Deepwater Horizon oil spill, and I've worked very closely with the United Nation here, and I can tell you that after the Deepwater Horizon, with a lot of downtime because of the oil and fishing industry, drugs and alcohol seeped into all what we call parishes, not counties, parishes here in Louisiana. And those communities were challenged with a lot of downtime, and along with it, a bump in both drug and alcohol use across all parishes, just not the United Nation. Next slide. This idea of self-efficacy. And so there's a trajectory here that begins with losing control over your traditions. And I know that for the Pala in particular, for the first time because of COVID-19, there are festivals that are not being held, I think after 46, 47 years. So these are certainly losses. There's a lot of grieving that goes on, and it also impacts your ability to be in control. With that, over time, can be a loss of cultural identity. Next animation. And that trajectory continues, that seeps into a loss of self-worth, so losing your compass. And finally, reduced self-efficacy, this idea that you have some control, some direction in that part of your life as it pertains to your community and your traditions. Next slide. So overall, the amplification, yeah, that's fine. You can skip. Yep. Go to the circle. There we go. All right, so we're going to shift gears. So I just gave you a little bit of background about what people have said about climate change and some very, very brief, if not shallow, pictures of what mental health can be. These concepts that you see before you now are solid in that they were created after Hurricane Katrina in an attempt for individuals in the mental health field to understand what basic elements are necessary for both immediate and long-term resilience in the face of disaster. So whether it's, you know, an acute disaster like a tornado or hurricane or wildfire, or say long-term recovery from any one of those, or in this case, climate change, these 5 elements are extremely important. And I would advise you all to put them to memory. And in the long term, you can think about how you plan or even communicate around these 5 elements. Next slide. So support for mental health amongst individuals comes in various ways. So this idea of self-efficacy, building one's own self-resilience is important. Fostering optimism, hope is that 5th element. Coping, active coping and self-regulation. If we were to work on the right side of that continuum, where I said on the left is more kind of stress, and the right side would say traumatic or trauma, this idea of self-regulation is extremely important. You see it everywhere, especially in teaching kids how to be resilient after man-made or natural disasters. So being able to regulate one's emotions is extremely important in long-term mental health. In fact, students, children who have endured some type of disaster who can self-regulate end up doing better socially and academically. Number 4, you want to be able to maintain practices that help provide a sense of meaning or meaning making. And so this idea of community efficacy, you know, getting together and celebrating tradition is extremely important. Sadly, in this day and age of COVID, none of us can truly celebrate those types of activities and traditions shoulder to shoulder. In a normal response, I would right now be recommending and promoting people simply getting together and sharing those traditions along with good information on how to recover. We've been denied that opportunity. Number 5, always promoting connectedness to family, place, culture. And if it's not in person now, we do it now virtually. Next slide. So this is skills for psychological recovery. This is one of the products of those 5 elements. Those 5 elements being safety, calm, connectedness, self and community efficacy, and finally hope. This is the updated 2020 manual, and the authors will tell you first, they hate the name. All right, so don't think of it as this idea of psychological. These are individual skill sets that individuals have used and communities have used to recover. In particular, and I'll cover it in a moment, this intervention, if you want to call it, or skill set, was used exclusively in the United Homa Nation after the Deepwater Horizon oil spill. Next slide. So what are the skills? I talk about this in very, very humble terms. This is about reinforcing resilience. I'm not here to teach you anything. You and your communities have been around for a very long time. However, these skills, when we experience adversity, can somehow wash away or become weaker. We become, as human beings, very myopic. And what I mean by that is we get very narrow in our focus. We can't see beyond the blinders. And that's just our brain's way of coping and reducing the amount of stimuli that we can process so we can survive. But these 5 skills, when taught either individually or in, say, larger classes or community groups in particular, are extremely effective. The first one is problem solving. It's one of my favorites. Behind social connections, I think it's the most important. So this idea of solving problems may sound simple, but when you're faced with a stressor, it's very difficult to come up with solutions, ideas, things that are quote unquote out of the box. In brainstorming together of ideas, especially creative ones, is most effective in a group process. The next one is promoting positive activities. This isn't so much of a skill as really a practice. So being able to engage in positive activities, getting together for games or going outside to exercise or to hunt or fish are all important. And so it helps bring us joy, not only because you have a feeling of success or fun, but most of the times it's also a social event. Managing reactions, I mentioned before, extremely important. Here we want to be able to teach ourselves and practice things like mindfulness or prayer or meditation, these things that bring us calm, breathing. These are all very important to settle our bodies so our minds can also handle the stress that's coming at it. Helpful thinking is a little more advanced. Here we want to be able to consider the adversity that we are facing, but be able to change the way that we think. So what we call cognitive behavioral therapy or cognitive behavioral approach, changing the way we think about an adverse event or challenging event would be important. And finally, rebuilding healthy social connections is really the mainstay. In fact, of all of these, if I was forced to just choose one, it would be healthy social connections that reigns true. And I think that if you have healthy social connections, a healthy community, and a strong connectivity to each other, the other four happen naturally. Next slide. So building problem-solving skills, like I said before, increases self-mastery, enhances the ability to take on certain stress and problems. In the future, I hope to be able to train in person for PALA, and what we were going to do is actually break all these out into working sessions. Problem-solving sounds easy, but there are certain steps involved with that. One's included is brainstorming. And so it's putting down as many ideas as you can, either individually or in a group, that are even a little bit crazy or odd or unusual, even humorous. But it helps not just with the end result, the solution per se, it's the process. The process of brainstorming is in itself therapeutic, if you want to call it that. So it can be not only fun, but it helps, again, break up that or expand that myopic view of the world, that very narrow view of the world. Next slide. So promoting positive activities, like I said before, in and after a natural disaster, this is not something that happens naturally. In fact, a lot of individuals find a lot of guilt in thinking about actually wanting or being able to enjoy themselves. So sometimes after disasters, positive activities do not come back quickly. In some communities, positive activities are impossible because the actual event, say an acute event like wildfire, causes things to disappear. And so we lose places where we meet or places where we enjoy, like parks. So this can be a challenge not only on the access issue, but also around grief and loss of what was once there for us to enjoy. Next slide. So managing reactions, again, embracing and practicing breathing, yoga, mindfulness, whatever brings your physiology back to, say, normal, to average, right? And so I think most of us have engaged in those types of practices, either alone or in a group. Don't lose those skills. It's the one thing that you have to hold on to that you don't need, although there are apps now. You don't need an app for this. There are good ones out there, but this is one that is completely free. And so engaging in good breathing practices, just finding peace in your day is important. So again, like I said before, and I think for adults like children, managing reactions is important. And by doing so, you can find a clearer head and the ability to face adversity straight on. Next slide. So helpful thinking. This isn't like Pollyanna attitude where we're going to be all positive. I can tell you, and you all may agree, that the world is not unicorns and rainbows, right? Bad things happen to very good people. What this allows us to do is accept the adversity, but create this chance of gratitude. So when I teach students this skill, I oftentimes allow them to use a trick of language and to place a semicolon in the word however or but. So it might sound like, you know, our playground was destroyed by the storm, however, and they can fill in that blank. That however allows them the chance to look at a brighter future, or at least have a helpful thought around what can be, accepting what has happened, but again, looking into the future about what can be helpful or say more positive in their life. Next slide. So rebuilding healthy social connections, engaging networks, activity levels, helps prevent depression and withdrawal. And so one of the strongest instruments that I've ever used across various natural disasters has been the concept of combining information with gatherings, in particular food. And so we have designed small scale lessons born of these 5 skills where communities come together to eat, and these skills are taught briefly and practiced. I think the combination of information about what's happened, what will happen as far as recovery is important, along with being together and breaking bread together. Next slide. So this is an example of an exercise that we do when we teach skills for psychological recovery. And a lot of you have seen this concept before. It's called many things, a social connectivity map. It can even look like a family tree. But we ask the question, what and who are we connected to? And how it's drawn is extremely important. That's why we like to do trainings in person, to kind of look at how people conceptualize their connections. Some of these lines for you, if you were to draw this today, may be thicker than others. Some may be dotted, some might be very thin or long. And we can acknowledge that in this day and age of video connectedness, that mother by phone might be mother by FaceTime. Sister by phone may be through another means of video platform or through texting. For kids, that circle, that empty circle, is often filled with pets. I'm sure as adults as well, we recognize that pets are a strong part of our family, and so they're often in there as well. So I just want to remind people that they are connected, and if you look even through your contact list in your cell phone, if you're bored someday, you can find all the people that you'll phone call to. So I'm just saying, if you want to get reconnected, now's a good time. Next slide. So this is from the WHO, the World Health Organization, and they use a pyramid to describe how we look at mental wellness or mental health. It's not about what I do as a psychologist. It starts way before that. The first is this idea of self-care, right? And a little bit of that self-care is now mundane. So yes, we don't eat too much, we don't drink too much. We be sure to exercise, get enough sleep. So we've heard it all before, but self-care is still the bottommost tier. If people take care of themselves physically and mentally, the idea is that they won't elevate themselves to a higher level of care. In this case, informal community care, which I have circled, and I'm going to highlight in just a moment. If these two levels are done well, caring for ourselves and caring for others, the idea is that we can relieve or prevent many people from maybe moving up into a more serious level where they might need primary care from someone like myself, a psychologist, for therapy. Next slide. So peer-on-peer support can come in various ways. The program, really what we call the conversation that you see before you is called How's Your 5. It was born in 2011. So after the EF5 tornado in Joplin, Missouri. It was created after focus groups that asked the question, kind of what's going on. And they had identified these 5 areas of concern. All of this getting beyond I'm fine, or this how's your 5, falls under what we would call that grander social connectedness. So this even puts a finer point on being connected and supporting each other. So asking questions about how's your work, How's your school is important. And getting people to really talk about it, not to say a good or fine. Love is really about relationships, relationship with friends, with family, with coworkers. Play is around the idea of positive activities. How people sleep and how people maintain their eating habits or what they consume is important. So How's Your 5 has been used in multiple communities throughout the US and abroad. Next slide. And so let me talk a little bit more about How's Your 5. And so thanks. And as it pertains to tribal health, it's been used primarily in the United Home and Nation, and they have found value in it both in their health clinics and in their day-to-day operations and how they connect with each other. Right now, I know they're having nightly calls to check in with each other, and they're using How's Your 5 as a way for people not to answer I'm fine or I'm good, to actually get them to talk about what's going on. Because if we don't get beyond the general, oh, I'm fine, I'm good, we don't get a true chance to support someone either emotionally, and I'm trying to understand the path that they're walking, or to actually physically support them in some way. Do they need help with something? I think many of us are of the kind of fabric where we believe that someone else has it harder than us or has it worse than us, and we want to pass off any help so they can go help other people. But sometimes we're the ones that need the help, and we need to be able to answer honestly how we're doing. Next slide. I mentioned this before, where do we put our focus? And so in a post-COVID-19 world, I would highly recommend this idea of fellowship, staying together, gathering together as much as you can. And with that, breaking bread, and then facts and information. So for some of you designing long-term programs and keeping your communities informed, I would highly recommend weaving in not only information around climate change and the sense of resiliency, but also facts and information around physical health, mental health, not throwing it all at once, but maybe just small tidbits, small just snaps of information. After the tornado in Joplin, we designed school program, we designed evening meals at schools that were currently closed. And we just did 10 minutes of FYI around, say, sleep, and then opened it up for dinner. And then the most important thing here, and if there's one thing to remember about these community gatherings, the most important piece of it happens at dessert. Why is that? People linger, people stay. The people that want to talk more will stay and discuss, and that's where you'll really understand where people or how people are struggling. And I highly recommend staying around for the dessert to listen to the needs of your communities. People want to talk, and if they're given the opportunity, they will, especially over, say, a cup of coffee or tea. Next slide. So this is one document, a guiding document that I can provide you through Angie or Shasta. It's designed to pay a particular focus on mental health and climate change. It's a comprehensive document. It's got some great authorship. It's deep, but if you're interested more in how climate change will impact mental health in your community, I highly recommend that you have this in your library. Next slide. Again, from this document, they recommend to certainly expand and assess where you are in your mental health infrastructure. So what type of services you have available to your community. You want to be able to reduce any disparities and pay attention to populations of concern. So that could be the aged, but in this day and age, I've found recently in the launching of telehealth, could be individuals who do not have the internet. So that's something to pay attention to. Train your community ongoing and how to respond to either acute or long-term disaster situations. You want to be able to augment and change the way you distribute supplies and be able to have clear and frequent climate mental health communication, which could include a webinar like this, but to really open it up to the group and not make mental health or mental wellness something that's strange or unusual. It impacts all of us, and as a psychologist, I want to be able to, in some ways, deconstruct the fear around mental health. It's a equal opportunity in the sense that most, if not all, families are impacted some way, shape, or form with mental health or mental wellness issues. And so to bring it to the forefront and not be shamed because of it, it's something that we often inherit naturally. But the positive is there's a lot of great things you can do either for yourself or amongst each other before needing some kind of formal service like I provide. So in my wish here in New Orleans is that I go out of business, that people take care of themselves so much and so well they don't need a higher level of care like I provide. Next slide. And that's me, but you can find me always through Angie and Shasta. So I'm gonna be quiet right now and give the wheel back over to them.
Thank you so much, Dr. Walker. We had a couple of comments come in that just was saying thank you for this topic. And if anybody has a question for Dr. Walker, we may have 1 minute to try to answer it, but go ahead and put something in the question box. We can always try to answer it afterwards as well. While you're doing that, again, thank you, Dr. Walker. Wonderful as always. He's actually going to be sticking around to help us with our SoCal regional cohort, which is starting at 12 o'clock. And so in between now and our next webinar, we just suggest that if you are part of a regional cohort to pay attention to the technical assistance meetings that have been scheduled and to please attend. We have one coming up tomorrow for Alaska, another on the 29th in the Midwest, May 7th for the Southern Great Plains. That should be Plains. And then just be thinking between now and the next monthly webinar how to gain early support and participation for your adaptation planning process. So you might consider things like a resolution and listing your stakeholders for your planning team. And then in between, we'll also send this out afterwards along with the recording and the slides for this webinar. Please read one of the following vulnerability assessments, just so that we can chat a little bit about it at the beginning of the next session, and it gives you an idea of what some of these look like. And our next session will be May 19th at 10 o'clock, and we'll cover the second portion of vulnerability assessments. And in the meantime, looks like Shasta is going to organize an email discussion on engagement strategies. So did anybody else comment, Shasta?
We did have a comment. It's a little bit of a comprehensive question. So I just said that we will make sure that Dr. Walker gets the question and we can provide that answer as part of our group email chain, because I know that people have other obligations, and so we want to be respectful of their time. But I want to thank Dr. Walker. It's always great to hear your presentations. Sometimes I have to blink a little bit because I'm like, that's me, and I'm going to start crying. So please send your questions. We'll set up that group IO, and we can get those questions answered for everybody.
Yes, absolutely.
Right. Thank you, everyone. We'll see you next time.
Bye.